Hi, I'm Paul. I live in Paris. I'm 52 years old and a father of 3 children. I just got a lung cancer diagnosis. I was pretty shocked, but then the doctors explained what was going to happen. I was able to see a psycho-oncologist integrated in the clinic routines to discuss how to cope with the situation, and even learned how my family can be supported. Within 2 weeks from the diagnosis, the tumor was red and I was on therapy. Molecular testing, they said, revealed the good news in this drama. I had a mutation in my tumor that could be treated with a specific, well-working therapy that is available in France to every patient in need. I have just a few side effects, nothing like hair loss or so, and I got an app on my phone where I insert my symptoms. Based on that, my doctors and the psycho-oncology care follow up on me regularly. I have already scheduled scans and am part of a national cohort for data follow-up. Hello, I'm Paul. I live in Bratislava. I am 61 years old and a father of 1 adult child. I was diagnosed with lung cancer a few weeks ago. It was a shock as I've never smoked in my life, have healthy lifestyle and no other disease so far. Soon after the diagnosis, I was hospitalized for the first doses of chemotherapy. The doctor said it's an old substance, but it may give me a few more months. My family and myself are very scared. On a daily basis, we search the internet for information, since there is not much we got from the doctors here. We feel pretty lost. The therapy is heavy. After a dose, I have to lie in bed for days. The next time I can see my doctors is when the cycle is finished to discuss further options.
Big plans like a EU beating cancer plan and the entire visions that are depicted there is not an easy endeavor. It requires the engagement of many people, of many institutions, and a joining of forces to acquire what is the aspiration called to improve the life of patients with cancer. This is the reason why we joined forces and created the Net4Care network. And I'm going to tell you a little bit about this network. This network was initiated from Roche representatives in Romania, and it quickly spread to Slovakia, Poland, Greece, and Germany.
The Net4Care pilot project addresses some of the identified barriers in PHC adoption in clinical practice. It aims to experiment strategy implementation and to co-create the needed mechanisms to overcome challenges like e-health, data sharing, and interoperability. Furthermore, to identify innovative and sustainable financing solutions that would increase the access to care with the main goal to reduce inequalities in cancer care.
5 European countries decided to working with doctors, hospitals, and oncology associations to start standardization of treatment lung cancer patients, as well in organization of diagnosis and treatment as access to innovative treatment.
Projekt is in cooperation with DKG, oncology network centers, which ensure the high-quality care for Slovak patients. Everybody we speak to, oncologists, authorities, is very excited about the project, although it's very complicated for the beginning.
We're planning on setting up multidisciplinary, quality-assured lung cancer centers in the pilot countries and connecting them through a cross-country data and research infrastructure. We're very much looking forward to working with exciting and interesting partners in our consortium and all striving to improve the outcomes of lung cancer patients in Eastern Europe.
This is a great opportunity for lung cancer patients in Greece, as it will help them experience a right diagnosis and provide them with access to the right treatment at the right time, finally achieving better and more personalized health outcomes.
My personal motivation comes from a real belief into equal access for cancer care. And I am confident that this highly motivated consortia of partners, together with a passionate and determined network, will together succeed to change mindsets and behaviors into creating a real personalized healthcare ecosystem.
And I love being here on board. I love working this fantastic team, and I really hope that in 2021 we keep it up and we manage to get the appropriate funding to bring this endeavor up to life and to have the first patients enrolled in this program by the end of the year. I'm keeping my fingers crossed and I'm wishing us all the best.